Let me start with something that took me years to fully appreciate. And I say that as someone who has spent the better part of 3 decades treating patients over the age of 60, teaching medical students, reading more research papers than I care to count. There is a daily choice that many people make, often without even recognizing it as a choice, that accelerates biological aging more reliably than most of the diseases we spend our time worrying about. More than moderately elevated cholesterol in many cases, more than blood pressure that runs slightly high, more than carrying an extra 15 or 20 pounds. I'm not talking about smoking. I'm not talking about alcohol. Those are obvious. Everyone knows those are harmful. What I'm talking about is something subtler, something that looks harmless, something that, frankly, can even feel like the responsible thing to do. And I'll get to what it is in a moment. But first, I want to explain why this matters so much, because the mechanism here is not what most people assume. When we think about aging, we tend to think about organs wearing out, the heart getting weaker, the kidneys losing function, the brain accumulating damage over time. And yes, those things happen, but they're not the whole picture. They're not even the main picture for most people. What I've come to understand, both from the research and from watching patients over many years, is that functional aging, the kind of aging that determines whether you can live independently, whether you can recover from an illness, whether you can get off the floor if you fall, that kind of aging is driven primarily by the nervous system and its relationship with the musculoskeletal system. And that relationship is remarkably plastic. It adapts. It changes based on what you do with it. This is the part that surprised me, honestly. When I trained, we thought of aging as largely inevitable. You hit 65, 70, and things declined. The question was how gracefully you could manage that decline. But the data from the last decade, and especially from the last few years, tells a different story. The nervous system, the connections between brain and muscle, the signaling pathways that control balance and coordination, these remain adaptable far longer than we assumed. Into the 80s, even into the 90s, to some degree. But here's the catch. They only remain adaptable if you challenge them. So, what is this daily choice I mentioned? It's the choice to stop challenging your body. Now, I know that sounds vague. Let me be more specific. It's the choice to sit more than you need to always take the elevator when stairs are an option, to lower yourself into a chair by plopping down rather than controlling the descent, to stop reaching for things on high shelves, to walk, but only on flat, predictable surfaces, to avoid anything that feels slightly difficult. It's the choice, made 100 times a day, to conserve effort, to stay safe, to not risk discomfort. And I understand why people make this choice. When your knees ache, you avoid stairs. When your balance feels uncertain, you move cautiously. When you're tired, you sit down. These are rational responses to real signals from your body. But here's what most people don't realize. The body interprets these choices as information, as instructions. When you stop asking your muscles to work through their full range, the nervous system downgrades its investment in those pathways. When you stop challenging your balance, the brain reduces the resources allocated to balance processing. When you stop moving in complex, varied ways, the coordination networks that keep you integrated, that keep you whole, they begin to simplify. This isn't weakness from disuse. That's part of it, but it's not the main issue. The main issue is neural. It's the loss of the body's internal map of itself, the loss of what we call proprioception and motor planning and sensory-motor integration. And once that begins to erode, everything else follows. Let me share some of the research that crystallized this for me. There was a study out of the University of Pittsburgh published in 2023 that followed a large cohort of adults between the ages of 60 and 85. They weren't measuring strength in the traditional sense. They were measuring something called neuromuscular coordination, essentially the efficiency of the signals between the brain and the muscles. What they found was striking. The participants who had the highest levels of neuromuscular coordination had dramatically better outcomes across the board. Fewer falls, obviously, but also fewer hospitalizations. Faster recovery from surgery. Lower rates of cognitive decline. And here's what really caught my attention. The differences in coordination were not primarily explained by how much people exercised. They were explained by the type of movement people engaged in. Participants who walked regularly, which is wonderful, don't get me wrong, walking is one of the best things you can do, but those who only walked showed similar coordination profiles to those who were relatively sedentary. The coordination benefits came from challenging movement, movement that required balance, movement that required strength through range, movement that required the brain to solve problems in real time. There was another paper, this one from King's College London, published in late 2023, that looked at brain imaging in older adults. They compared two groups. One group did standard aerobic exercise. The other group did what they called complex motor training, things like stepping patterns, reaching tasks, movements that cross the midline of the body. After 6 months, both groups showed some benefits, but the complex motor training group showed significantly greater preservation of white matter integrity in the brain. The connections between brain regions, the infrastructure that keeps everything working together. This is not what we expected to find 20 years ago. The idea that specific types of movement could influence brain structure in people over 70, that would have seemed implausible. But the evidence is quite consistent now. So why does this happen? What is it about challenging movement that preserves these systems? Let me try to explain this the way I explain it to my students. Your brain maintains an internal model of your body, a kind of map. This map tells the brain where your limbs are in space, how much force you're generating, how your weight is distributed, what you're capable of doing. This map is not static. It's constantly being updated based on feedback from the body. Every time you move, you're sending information up to the brain, and the brain is using that information to refine the model. But here's the key point. The brain only invests in maintaining the parts of the map that are actually being used. If you stop moving your arms overhead, the brain gradually loses the detailed representation of that range. If you stop balancing on one leg, the balance circuits become less precise. If you stop getting down to the floor and back up, the motor planning required for that sequence begins to degrade. And the brain does this efficiently. It's not wasteful. If a pathway isn't being used, resources are reallocated elsewhere. The problem is that after 60, this process of neural pruning can accelerate. The brain becomes more aggressive about eliminating unused pathways. So the choices you make about movement have outsized effects. When you choose day after day to avoid challenge, you're essentially telling your brain, I don't need this capacity anymore. And the brain listens. I want to be careful here, because I'm not trying to blame anyone. I see patients every week who are dealing with real limitations: arthritis, old injuries, chronic pain, fatigue from medications. It's not always easy to move, let alone to move with intensity. But what I've learned is that even small challenges, done consistently, can maintain these neural pathways in ways that effortless movement cannot. It's not about being athletic. It's not about going to a gym or following some complicated program. It's about introducing enough challenge, enough variability, enough demand that the brain continues to invest in your body's full capacities. And this is where I want to shift from the problem to the practical side of things. There are certain movements that seem to have disproportionate effects on preserving neuromuscular function. I want to walk through 5 of them, not as a prescription, but as a framework for thinking about what actually matters. The first is what I call the controlled sit to stand. This is different from just standing up from a chair. Most people, when they stand up, use momentum. They rock forward, push off the armrests, and kind of throw themselves upward. There's nothing wrong with this in daily life, but it doesn't challenge the neuromuscular system very much. A controlled sit to stand means lowering yourself into a chair slowly, with intention, and then rising slowly, without using your hands. This requires the brain to coordinate the muscles of the hips, the knees, the ankles. It requires eccentric control, which is the ability to control a movement as the muscle lengthens. This is actually more demanding than concentric strength, and it's one of the first things to decline with age. When I started having patients do this in my practice, I was surprised by how difficult it was for many of them. People who could walk for miles struggled to stand up from a low chair without their hands. That told me something important about where the deficits actually were. The second movement is single leg standing. This sounds trivial. It is not. The ability to balance on one leg for 30 seconds with your eyes open is one of the best predictors of functional aging that we have. Better than grip strength, better than walking speed in some studies, because it requires the integration of so many systems at once: the vestibular system, the visual system, the proprioceptors in the ankle and foot, the core musculature, the brain's ability to make rapid adjustments. And this is a capacity that absolutely declines with disuse. If you never challenge your balance, you lose the balance circuitry. The brain stops maintaining it at the level of precision required to prevent falls. I recommend that people practice this daily, even just while waiting for coffee to brew or standing at the sink. Just lift one foot slightly off the ground, hold for as long as you can, switch sides. This is not exercise in the traditional sense. It's neural maintenance. The third movement is a reaching pattern that challenges the full range of the shoulder and spine. I see so many patients who have lost the ability to reach overhead. They can't get dishes from a high shelf. They can't wash the back of their head in the shower. They've lost that capacity so gradually they don't even realize it's gone. And this matters not just for the shoulder, but for the spine. When you reach overhead with intention, the thoracic spine has to extend. The ribs have to expand. The nervous system has to coordinate this complex chain of movements. When people stop reaching, they stiffen. And that stiffness creates a cascade. The spine becomes more rigid, breathing becomes shallower, posture deteriorates, and the brain's representation of the upper body becomes less accurate. I encourage people to reach every day, not just passively, but with intention. Reach for something slightly higher than is comfortable. Hold it for a moment. Let the body remember that this range exists. The fourth movement is some form of stepping that involves height change. Stairs are the obvious example, but even step-ups onto a low platform work. The key is that the body has to lift its own weight vertically. This requires a very different neural pattern than level walking. It requires more hip drive, more glute activation, more core stability, and there's something else. Climbing stairs requires what we call anticipatory postural adjustments. Before you even lift your foot, the brain has to shift your weight, stabilize your trunk, prepare for the destabilization that's about to happen. This is complex motor planning. It's exactly the kind of neural work that gets lost when people avoid stairs. I had a patient a few years ago, a woman in her mid-70s, who had gradually stopped using the stairs in her home. She had a small bathroom on the main floor, a kitchen, a bedroom she converted from a den. She hadn't been upstairs in over a year. When we tested her, she couldn't do it. Not because of pain, not because of shortness of breath. She simply couldn't coordinate the movement anymore. The neural pattern had eroded. We worked on step-ups for 3 months, just a low step, in my office, very gradually increased the height, and eventually she was able to climb her stairs again. But it took real work. The capacity doesn't come back easily once it's gone. The fifth movement, and this is the one I want to spend more time on, is cross-body coordination. This is, to the best of our understanding, the most neurologically demanding type of movement you can do, and it's the one most people never practice after childhood. Cross-body movements are movements where the opposite arm and leg work together. Think about crawling. Think about throwing a ball. Think about walking with a natural arm swing. where the right arm swings forward as the left leg steps. This kind of movement requires the two hemispheres of the brain to communicate intensively. The corpus callosum, the bundle of fibers connecting the hemispheres, is heavily engaged. The cerebellum, which coordinates timing and precision, is working hard. The motor cortex on both sides is firing in a coordinated pattern. And here's what the research suggests. This type of movement may have unique benefits for preserving brain function. There was a study from the University of Illinois, published in 2024, that looked at cross-body exercises in adults over 65. They used a simple protocol. Participants did movements like touching their right elbow to their left knee, reaching across their body, stepping patterns that alternated sides. After 12 weeks, the participants showed improvements not just in coordination, but in cognitive tests. Specifically, tests of executive function, planning, decision-making, cognitive flexibility. Now, I want to be careful here. This was a single study, relatively small sample size. I'm not claiming that cross-body movement is some kind of brain training miracle, but it fits with what we understand about how the brain works. The more complex the motor demand, the more neural resources are engaged. And the more neural resources are engaged, the more the brain is stimulated to maintain those circuits. What I tell my patients is this: walking is wonderful. Please keep walking. But walking alone is not enough. Walking is rhythmic. It's automatic. Once you've been doing it for 60 years, your brain doesn't have to work very hard to maintain it. It's like driving a familiar route. Your brain can do it on autopilot. What you need, especially after 60, is movement that takes you off autopilot. Movement that forces the brain to pay attention, to solve problems, to update its model of what your body can do. This doesn't have to be complicated. It doesn't require equipment or a gym membership, but it does require intention. Let me talk now about expectations, because I think this is important. If you start doing these kinds of movements today, you will not feel different tomorrow. You probably won't feel different next week. The changes are gradual, they're subtle, and they're happening at the level of neural connectivity, which is not something you can perceive directly. What people typically notice, in my experience, is something like this. After a few weeks, the movements themselves become easier. The controlled sit to stand that felt impossible starts to feel manageable. Balance improves. Standing on one leg goes from 5 seconds to 15 seconds. After a few months, people start noticing changes in daily life. They feel more stable on uneven surfaces. They're less hesitant on stairs. They feel more confident in their body generally. After a year or more, the effects are more profound. Falls become rare. Recovery from illness is faster. There's often an improvement in energy, in mood, in overall sense of physical well-being. But none of this happens quickly, and it only happens with consistency. A few sessions of exercise are not going to rebuild neural pathways that have been neglected for years. This is about daily practice, or near daily. Even 5 or 10 minutes, done consistently, matters more than an hour done sporadically. I want to close by saying something that I think is important for people to hear. It is not too late. Whatever your age, whatever your current limitations, the human body retains the capacity to adapt far longer than we used to believe. The nervous system is plastic. The muscles respond to challenge. The brain can rebuild connections that have been dormant for years. But the body needs to be asked. It needs to be challenged. It needs to be shown that these capacities still matter. The small daily choice I mentioned at the beginning, the choice to avoid challenge, to stay safe, to conserve effort, that choice is understandable. But it has consequences that accumulate invisibly until one day you realize you can't get up from a low chair, or you can't catch yourself when you stumble, or you can't climb the stairs to your bedroom. And at that point, the path back is harder. Not impossible, but harder. The easier path, the one I encourage everyone over 60 to consider, is to challenge the body every day, in small ways, in ways that don't require special equipment or special time, just the intentional choice to do things the hard way, at least some of the time. Control your descent into a chair. Stand on one leg while you brush your teeth. Reach for the high shelf instead of getting a step stool. Take the stairs when you could take the elevator. Practice a cross-body movement for a few minutes each morning. These are not dramatic interventions. They will never make headlines. But they are, to the best of my understanding, among the most powerful things you can do to preserve your independence, your function, your quality of life as you age. I have watched too many patients decline not because of disease, but because of disuse, because they chose comfort over challenge, day after day, until the body forgot what it was capable of. And I have watched others, sometimes with significant health problems, maintain remarkable function into their 80s and 90s because they never stopped asking their bodies to do difficult things. The difference between these two paths is not genetics, it's not luck, it's the accumulation of small daily choices. So, my hope is that you will make different choices, not dramatic ones, not exhausting ones, just intentional ones. Every day, that's what I have for you. Thank you for listening.